Two brothers from Kenya found new job opportunities at Penn State Health. In fact, one changed his field and got into healthcare. The Dawood brothers share their journey. Imran and Yasin Dawood are brothers who share the same passion. They work closely together as respiratory therapists at Penn State Health. Their journey began a continent away in Africa.
I was born and raised in Kenya. My great-grandparents, they came to Kenya with the British Army to build the railroad. And once they were done building the railroad, connecting East Africa together, they decided to stay there. We are the fourth generation there.
Imran and his family moved to the United States in 2008. A year later, his brother Yasin made the same trek.
I worked in the banking industry. I worked at the bank for 4 years before I moved up here. Total different environment in a banking field, and then working in healthcare. Two different jobs, two different outlooks and everything with the job.
The brothers found entry-level positions at Penn State Health, and it opened their eyes and hearts to the medical field.
We got to see what people did at the hospital, from nurses to doctors to respiratory therapists. We were able to see how everybody is involved in that field, and that made us be very interested in the respiratory therapy field.
By fall of 2009, we enrolled ourselves in school. We didn't want to waste much of the time. I was like, all right, let's just get this started.
They attended Harrisburg Area Community College to pursue a career as a respiratory therapist. After graduating, they started practicing at Penn State Health, something they've done for the past 10 years.
It's a fantastic place to work. We get to work everywhere. And that's the good thing about being a respiratory therapist. You're not confined to working in one floor. You work in the ER, you go work in critical care.
You can be in NICU, work with the kids if you love to do that. You can work with the elderly population. So there's a big broad area on what you can do as a respiratory therapist.
The COVID pandemic really highlighted the role of respiratory therapists.
Some people thought we just give breathing treatments at the hospital, but that's not all we're involved in. We're involved in, the entire management that involves the lungs, the breathings. Now, if your body does not get enough oxygen, not just your lungs are affected, everything else is affected.
Critical treatment that Imran and Yasin do every day, side by side.
It's just been a pleasure working beside my brother because, number one, we have the same schedule. We can do things together at home. We take vacations together. We plan our trips together, and it makes life easier.
Yeah, I wouldn't have done it, I would say, without him. I wouldn't have done the whole process of being a respiratory therapist without him. It was a joint effort. It was not something that I would have said, I'm going to go do this by myself. No, it was something that we decided together.
Now the brothers encourage others to delve into this field.
I would say it is very, very rewarding job. I love doing what I'm doing, and that's the only reason I picked being a respiratory.
I don't see anybody in the area, honestly, competing with Penn State Health, because what we do at Penn State is way far ahead, way far better than nearby hospitals. So for aspiring students, for new grads, this will be the place to start, Penn State Health.
Now, after 10 years as respiratory therapists, the brothers want to do more in the healthcare field. They are studying to become physician assistants.